Hi, I'm Hilary Talbot, acupuncture physician and clinical herbalist. Today we will be discussing acupressure in treating sciatica. Now, sciatica is pretty painful if you've ever experienced it before, and it can actually present in a number of ways. The traditional presentation of sciatica is pain in the hip and where it runs down the lateral side of the leg. However, some people experience it right down the back of the leg, and then a few people actually experience it where it wraps around the front of the leg. So when you go to an acupuncture physician, they'll actually differentiate which channels it's affecting most and treat based on that. But one point that you can almost always use on yourself for the symptom relief, not to treat the root cause per se, but the symptom relief, is gallbladder 30, sometimes called the pocket point, because a lot of times it's located right where the edge of your pocket is, right here in the buttocks, and you can kind of search around till you find that tender spot, and it's pretty deep down. So a lot of times you have to use a thumb or even an elbow. So if you've got a lot of padding right there, you might convince a loved one to actually kind of dig their elbow in and give you some relief. And as soon as you let up, a lot of times that relief will come. And what you're doing is you're just trying to increase circulation into that area. The SI joint has a number of muscles in addition to the sciatic nerve that runs through it. And sometimes it's not the nerve itself that's the issue, but one of those muscles can get locked up and kind of clamp down and press against the nerve, and that sends the nerve type of pain running down the leg. So use gallbladder 30 on yourself. You can also just use your thumbs and come around to the back and press your thumbs in that point for a little bit of relief. But then I encourage you to seek out your local acupuncture physician so that you can get the correct treatment for the symptoms you're experiencing. I'm Hilary Talbot, and that was Acupressure for Sciatica.